Hi, I'd like to welcome everybody. My name is Renee DiResta, and I'm the Technical Research Manager at the Stanford Internet Observatory. This event is hosted by the Stanford Internet Observatory, part of the Cyber Policy Center at Freeman Spogli Institute at Stanford. Today's event is being recorded, and we are live streaming on YouTube. I'm going to start by briefly saying a couple things about SIO and the Virality Project. So SIO is a research lab focused on studying internet abuse in real time. And as part of that work as COVID began to take hold and to spread, we started a collaborative project called the Virality Project with colleagues at University of Washington Center for an Informed Public, NYU, the National Council on Citizenship, and Graphica, as well as the Digital Forensics Research Lab, to monitor the spread of COVID-19 related vaccine misinformation and to communicate emerging narratives to individuals working on the front line who were suddenly found themselves countering both a pandemic and an infodemic. We are waiting on the Surgeon General to join us, and as we wait for him to arrive virtually, Elena Christ, the Assistant Director of Stanford Internet Observatory, and Matt Masterson, one of our fellows, are going to tell you a little bit more about the work that we've been doing as part of the Virality Project.
Dr. Murthy is going to start off with a few remarks today, and then we'll have a panel of experts speak to the group. With that, I would like to turn the floor over to Chase Small, who's one of our undergraduate students who's a lead researcher on the Virality Project. Chase, take it away.
Thank you so much, Elena. My name is Chase Small, and I am an undergrad at Stanford University studying international relations. I am very excited today to introduce Vice Admiral Vivek Murthy. Dr. Vivek Murthy is the 21st and current Surgeon General of the United States, a role he previously held from 2014 to 2017. As the nation's doctor, the Surgeon General's mission is to restore trust by relying on the best scientific information available, providing clear, consistent guidance and resources for the public, and ensuring that we reach our most vulnerable communities. As the Vice Admiral of the U.S. Public Health Service Commissioned Corps, Dr. Murthy commands a uniformed service of 6,000 dedicated public health officers, serving the most underserved and vulnerable populations domestically and abroad. Raised in Miami, Dr. Murthy received his bachelor's degree from Harvard, his master's in business administration from the Yale School of Management, and his MD from the Yale School of Medicine. With that, I am truly honored to turn it over to Dr. Murthy.
Well, thank you for that kind introduction, Chase. I really appreciate it. And thanks to all of you for your patience, as I know we're getting started a bit late here on my side. I particularly want to express my gratitude to the Stanford Internet Observatory for your work to conduct in-depth research and articulate a vision for the public good. Now, I know everyone on this call appreciates the power of good information, and I know we've all experienced moments when information empowered us to make good decisions about our health or the health of a loved one. Maybe your doctor helped you understand the importance of regular exercise, and that helped you get to a healthy weight and improve your mood. Maybe you have a family member who struggled to stop smoking until they learned about evidence-based support programs that finally helped them quit. Maybe you were reminded to get a routine eye exam, and that led you to get glasses and see clearly for the first time. During the past year, information about COVID and how it spreads has helped many of us stay healthy. We learned that masks could help prevent transmission. We learned that physical distancing and staying outdoors could allow us to safely see our friends and loved ones. Sometimes this helpful information has come straight from credible sources, like your primary care doctor or the CDC. But it's also come from sources closer to us, like the neighbor who heard you cough and forwarded you a flurry of WebMD links on COVID symptoms, the concerned relative who tagged you in posts on everything from ventilation protocols to double masking. And if any of you are on Twitter, you know that we've had an explosion of armchair epidemiologists who can often be found passionately debating infection curves and predicting the next wave, and of course, sharing their recommendations with all of us. Now, as easy it would be to scoff at these people or to say that they're speaking out of turn, I actually think their instinct reflects the good in our humanity. We stay curious, we pick up new terms, and we share what we learn with others. But that good instinct can be harmful when what's being shared is health misinformation, information that is false, inaccurate, or misleading according to the best evidence at the time. And it's harmful even if it comes about through an unintentional game of internet telephone. Because today we share a worldwide network of emails, social media, YouTube videos, and online forums. and just one click can boost a falsehood across these networks before we can put on the brakes. In fact, misinformation can travel faster and reach more people than the truth. An analysis of millions of social media posts from 2006 to 2017 found that false news stories were 70% more likely to be shared than true stories. This information blitz can leave our heads spinning, unsure of what to believe or where to turn for the truth. And it has had real consequences for our health. During the pandemic, we've seen misinformation about masks, COVID-19 treatments, and COVID-19 vaccines. A recent survey found that 2/3 of unvaccinated adults have heard at least one COVID-19 vaccine myth and either believe it's true or aren't sure. The sad truth is that during this pandemic, misinformation has divided our friends, families, and communities. It's led to threats against our public health workers who try to enforce safety measures. And it's cost us so many lives. But misinformation didn't start with this pandemic. For decades, we've seen persistent rumors about HIV/AIDS that have undermined efforts to reduce infection rates. And during the Ebola epidemic, misinformation spread rapidly on social media, sowing confusion and escalating discord. Now, outside the scope of epidemics or pandemics, health misinformation has caused everyday harm, leading people to turn down effective treatments for cancer, heart disease, or other illnesses. The bottom line is that health misinformation takes away our power to make the best decisions for our health and the health of our families. That's why today, I'm releasing my first advisory as a 21st US Surgeon General, declaring that health misinformation is an urgent public health threat that we must confront together. I want to be clear that believing or sharing misinformation doesn't make us ignorant or ill-intentioned. It makes us human because we all want to do everything we can to keep ourselves and our loved ones healthy and safe. So when we read an alarming social media post, when we come across advice on a website that seems helpful, it's natural for us to want to pass it along to others. We're trying to stay informed, ask questions, and share concerns. The problem comes when the information is not just wrong, but it's also amplified by three things that supercharge misinformation: fear, polarization, and technology. Let's talk about fear for a moment. It's not hard to understand what's contributed to fear, especially during this past year. We've been through a roller coaster of infection surges all over the world. We've experienced the trauma of losing loved ones, sometimes without a chance to say goodbye. And many of us worried about the toll of this pandemic, not just on our lives, but also on our livelihoods. Fear is also sharpened by prior experiences, and many people have had painful experiences of neglect or abuse by the very systems that are supposed to look out for their health. But no matter the source, when fear dominates, it clouds our ability to sift through information and discern what's accurate. Fear also contributes to polarization, when we become distrustful of those who don't share our beliefs or life experiences. In such cases, distrust can turn to anger and resentment, which can make it difficult for us to hear people who don't share our worldview and lead us to discount information, even from credible sources. If we're not careful, we can go down a path where we find ourselves looking to believe anything that proves the other side is wrong, even if that information is false or misleading. Technology also plays a role in this dynamic, exacerbating our polarization and making us more prone to sharing misinformation. Product features, such as the like button, reward us for sharing content that will prove popular, and emotionally charged content usually wins out over accurate content. Algorithms also tend to give us more of what we click on, and they pull us deeper and deeper into the world of misinformation exactly when we need to get out of it. With misinformation in nearly every language and corner of the globe, amplified by fear, polarization, and technology, it can leave us feeling like we're playing a game of tug-of-war, one where we're being pulled in many different directions. If we want to fight health misinformation, we'll need all parts of society to pull together. That's why this Surgeon General advisory has recommendations for everyone. We're asking clinicians to address misinformation with their patients. We're asking educators to strengthen information literacy programs. We're asking researchers to help us learn more about how misinformation spreads. We're also asking journalists and media outlets to address the public's questions without amplifying misinformation. We're asking technology companies to operate with greater transparency and accountability so that misinformation doesn't continue to poison our sharing platforms. And we know the government can play an important role too, bringing stakeholders together with urgency around a common vision for a healthy information environment, as well as supporting community organizations that are trying to get accurate information to their community members. Now, these are big aspirations for big groups of people, because the only way we get through a public health crisis is to recognize that every sector of society shares in the responsibility. And already we see organizations stepping up. Today, the Rockefeller Foundation is announcing a $13.5 million commitment to counter health misinformation in the US, India, Africa, and Latin America. The Digital Public Library of America is announcing that they will convene a set of librarians, scholars, journalists, and civic leaders who will spotlight the wealth of resources that our nation's library system brings to fight against misinformation. And the American Academy of Pediatrics is announcing that they will develop an education campaign to help parents navigate online health information. I'm encouraged to see these organizations committing to take action, and this is just the beginning. But I also want to remind us that each of us as individuals has the ability to turn the tide on misinformation, because we all have the power to create healthy dialogue. We can listen with an open mind and an open heart. We can seek not to judge before we understand other people's point of view. We can establish common ground. We can ask questions to better understand someone's fears and hopes for better health. And if we do that, if we commit to hearing each other, our dialogue will do what a million ads and AI moderators cannot: build trust, creating the kind of trusting relationships that are the best pathway for reliable information to make its way into people's lives. And those bonds of trust, that can be the lasting legacy of our collective effort to confront misinformation, building not only a healthy information environment, but also a kinder and more connected world. On a personal note, I just want to say that it's painful to see every day people who are getting COVID-19, who are losing their lives to COVID-19, knowing that in many cases that could have been prevented. And I say that as someone who has lost 10 family members to COVID-19. And I think so often, what would it have been like if they actually had access to a vaccine? But I also say this as a dad who's got 2 young children who are not yet eligible to be vaccinated, and who knows that our children are depending on the rest of us to get vaccinated in order to shield them from the virus. Every week when I talk to doctors and nurses around the country, I can hear the exhaustion and burnout in their voices as they take care of more and more patients with COVID-19 who did not get vaccinated, all too often because they were misled by misinformation. This is why it is so important that we confront misinformation as a nation. Each one of us has the power and responsibility to make a difference in this fight. And there's no question that lives are depending on it. In the rest of our conversation today, we'll be hearing from some people who've been on the ground, addressing misinformation through hard-earned trust and empathy. I'm excited to learn from them. So we're going to transition now to questions for our panelists. And the first question that I'm going to ask all of our panelists is first for them to introduce themselves and share a brief overview about how health misinformation has affected them and their family and friends. Let's start with Professor Caulfield, and then we'll move to Katrina, Kevin, and then Dr. Beers.
Thank you. Well, personally, I think it's been frustrating. Like, as with all of us, I have had family members who have they're not necessarily anti-vaccine, but they have dithered, and approaching that discussion, especially in my field, and understanding some of the things that understanding the importance of it has been a struggle. I work with educators. I teach educators how to teach students to discern fact from fiction on the web and everything in between. But when it becomes personal, and we even see this in some of the questions that have popped up so far, when it becomes personal, it's it can be a touchy subject. And I think the thing to remember is it's a whole of society effort. Mm-hmm. And when people hear this from multiple places, we're going to be a lot more effective than if it's one person having to make that case.
Absolutely. Katrina, we'll go to you next.
Hello, my name is Katrina Randolph. Thank you for having me today. It's such an honor. I'm a certified community health worker through the state of Maryland. I'm also part of the HAIR Network initiative that stands for Health Advocates in Search and Research. Misinformation it's been tough being able to share information with people who are stuck in misinformation. So what I've been doing is kind of like encouraging my family, friends, and colleagues and clients, giving them informative information so that they can make decisions for themselves when it comes to this vaccination, because a lot of people are stuck in misinformation due to social media and things like that. So what I do for my client base and family and friends, I just encourage them to get factual information from the healthcare professionals. Don't go on what you're seeing on the media, because if you're not getting it from the healthcare professionals, then don't take this information into account.
Appreciate that. Yeah. And Kevin?
Hi, everybody. Thank you, Dr. Murthy. Health misinformation has been hard for us to combat because of how much it's permeated everything on social media, even in media in general. And it's been difficult for me personally, because a year ago, this time, the hospitals were well over 300% capacity trying to take care of people. And all these numbers we see on screens, I think a lot of people forget as they report them that every number represents a person, a loved one that's not home with their family. And it's been hard because now, a year later, everyone has access to a vaccine, but 94% of my patients in ICUs here in Miami are unvaccinated. And it hurts because I know from talking to them that they wish they had gotten the vaccine, but they were more afraid of the virus, more afraid of the vaccine than they were the virus. And it's painful because I know that most of them won't make it home. And so combating health misinformation is important to us, personally, I think, in medicine, but also professionally, because it's part of what we must do.
That's heartbreaking, Kevin, to hear. And I still always remember the first time you and I spoke, and you told me that you stopped counting after, I believe, your 135th patient died from COVID. I just remember thinking what unimaginable stress and pain that was for you and for the others who were caring for so many patients, especially at the height of this pandemic. Thank you. Thank you for what you're doing. Dr. Beers, I want to come to you last. It is good to see you again. And we'd love if you could share with us a little bit about how health misinformation has affected you. How's it shown up in your life at work, but also at home and among your family and friends?
Oh, well, thank you, Dr. Murthy. It's really nice to see you again as well. Very nice to see you. So my name is Lee Beers. I am the current president of the American Academy of Pediatrics and a community pediatrician in Washington, D.C. At Children's National. And I think, as you point out, pediatricians, we're not new to navigating these harms of health information. And I think particularly when it comes to vaccines, but not just vaccines, dangerous misinformation has been spreading online for many, many years, and really, frankly, doing tremendous harm to children's health. I think, in my own practice as a pediatrician, my experience is that, parents want to do the best for their kids. And part of that is learning about their health treatments and learning about their health. And so they go online, they go to all the places where they know. And I think, when they go and they find misinformation, it just, you said this earlier, it takes away their power to make good decisions because they're bombarded with information from all angles, and they don't know how to determine what's real, what's not real. And the more you see, the more you start to question. And so I think in my personal experience, being able to have those conversations with families and say, this website is a really, really reputable one. You can really trust information you get there. This one I'm not so sure about. Why don't you bring it to me? And we can talk it through. I think those things make make such a difference. And I would say I'm so grateful actually for this report and for this partnerships that we're developing here, because as pediatricians, I really believe we're trusted messengers, but in many ways we're underdogs in this fight. We're to Kevin's point, we're in there seeing patients all day long, and the amount of misinformation is really overwhelming. And so we're trying, and we're getting in there, and we're doing all sorts of things to help combat it. But we're so appreciative of this effort and the collaborations that are developing through this effort to combat misinformation.
Well, thank you, Dr. Beers. And you're absolutely right that it is not an even playing field right now. The voices of misinformation are drowning out credible voices like the four of you. And that's something that we have to change. It's one of the reasons that we issue this advisory. Dr. Caulfield, I want to come back to you for a moment. Educators at all levels, as you know better than anyone, are facing the negative impacts of health misinformation. I'm curious what stories you've heard from your work with educators about what they're facing and how they're dealing with the misinformation that's coming their way. And if you could also just share any examples that you have of how they've overcome any of those waves of misinformation, that would be wonderful.
Sure. I think there's a couple important things to note. The first thing is that educators are very excited to teach this sort of stuff. I think there's a vast untapped energy among educators who see this social problem and want to address it in the classroom. All they need is a little bit of support in terms of faculty development and some curricular materials that they feel comfortable with, right? It doesn't actually take much, but they need enough to get started. The passion is there, and I think it's just a vast untapped resource of sort of goodwill and a desire to improve the situation that we're kind of leaving on the table right now. The other piece that I will say with educators is that once they get started with this stuff, they find it engaging. They get the students engaged. And we also find that when teachers teach strategies like lateral reading is a strategy that we use where we encourage students when they encounter misinformation to not immediately engage with it, but to very quickly sort of figure out where it came from, who else is saying it, what others are saying about that claim. When they teach these lateral reading skills to students in any domain, so even if they're not in the domain of health, we do find benefits to the students in other domains. So you can teach it, for example, in history. You can teach these skills in history, and you find that the students are able to apply them in nutrition. And that's one of the more exciting findings that we've had in recent years. As far as successes, I think there are successes. We just finished up in Canada, actually, a large 100 school pilot of these skills, and students massively improve their ability to sort fact from fiction in these ways. And the teachers left it incredibly excited about this work. So the passion is there. I think the research has caught up into what works. I think we just need to put that together in a package.
That's really good to hear. And I really do like this concept of lateral learning that you mentioned as well. I wish they had that in school when I was growing up. That seems like a lot of fun. But one follow-up question for you, if we think about how science is taught, like in the classroom, most people probably think about images of beakers and test tubes, the scientific method, maybe even you remember the periodic table from that. But we don't spend as much time on what makes a source reputable, how to evaluate which scientific information is credible. How can we do better to support students so that they have the confidence and know-how to look up sources and determine whether or not they're reputable?
Yeah, I love that question. One of the things that we do very well, I think, in schools is science as sort of an individual effort, right? You're a scientist, you get out the test tubes, you get out the lab log, you do the science, you look at the data, you come to conclusions. And that's incredibly important. A lot of people here on this panel, that's how they got their start. That's how they develop their interest. That's what sort of moves us forward. But science isn't only an individual enterprise. In fact, the power of science, the power of research, the power of all of these things comes from the social enterprise of science. It comes from the ways in which we have structures like peer review. We have public agencies, which produce reviews of data and make recommendations. And we teach almost none of that directly in school. And so, I often joke, you tell any recent high school graduate, you say, hey, what's the powerhouse of the cell? And they'll be like, mitochondria. But you ask them, so what's the difference in the mission of the NIH and the CDC? You're going to get a blank stare if the NIH has ever been mentioned at all. And yet, for most students, understanding, for example, that when Dr. Fauci says something that is not just Dr. Fauci riffing on a subject, but it's actually the product of a larger process that ensures that the information getting out to people is the best information that we can provide. Understanding things like the difference between a preprint that someone links you to and something that's been in a journal, difference between a blog post in a journal, what a predatory journal. None of this stuff is taught, and yet it's those social aspects of sciences, that social epistemology that students most need when they're making their civic decisions. So we've got to absolutely still do that sort of individual science training, but we've also got to broaden it out and talk about the knowledge infrastructure in our society and how to navigate it.
Really good points. I want to move to Katrina. And Katrina, I just, in reading about your work, I just love what you're doing. And you briefly touched on your experiences with the University of Maryland's Hair Initiative. But I'd love for you to tell us a little bit more about the conversations that you've been having. Like, what did they look like, those conversations with your clients? Like, how do you start them? What do you do when they become difficult? And I'm curious why you think this program has been so successful in your community.
Well, normally what I do for my clients, once they come to their salon appointment visits, we have conversations all the time. So we start out by having consultations on their hair, and then we go into the COVID conversation about how they feel about the vaccine and things of that nature. So what I try to do for my clients is I keep a lot of literature around the salon that touches on COVID, the vaccine, the misinformation, healthcare information, where you should get the most important information from. And a lot of times the conversations are not too difficult, but when they become difficult, I just hand them the literature in the conversation because I don't want to be judgmental in encouraging them to be vaccinated. But the Maryland University Hair Network has been an awesome experience. And the reason being is because Dr. Thomas had created this program over 10 years ago for barbers and stylists to educate them on health disparities so that we can have factual conversations behind our chair. So so when COVID came about, it just opened up a whole different avenue for us to be able to advocate for our clients, to be able to have factual information to share with them, to be able to try to deter them from misinformation so that they won't use this misinformation to make sound decisions for their lives. So the Hair Network has been awesome.
Oh, that's so good to hear. So good to hear. And I just want to applaud you for having the courage to have those conversations. As somebody who grew up, with a very shy personality and still is actually, quite an introvert, I can only imagine how tough it must be sometimes to summon the courage to raise these kind of topics with folks. So I really appreciate what you're doing. And I'm just curious, you could have just kept doing your job and not bothered, with this work around COVID, but what compelled you to take action in your community to help folks get vaccinated?
One of the reasons I wanted to take action, because a lot of my clients that were sitting in my chair, especially the younger generation of clients, they came in with so many different conversations about this misinformation, and they were very hesitant to getting vaccinated. So I just wanted to make sure that I was an advocate for them, being able to encourage them to get vaccinated, to know that if you're not getting vaccinated, if you're not going to take plan A, then what are you going to do for plan B to protect yourself along with your loved ones? So I just wanted to make sure I had that factual information to be able to share with them, to make sure that I was advocating so that I would be able to help them make decisions for themselves and make the right factual decisions.
Wonderful.
Yeah.
Well, Kevin, let's move to you next. And I mentioned, Kevin, you and I have spoken previously about some of your experiences on the front lines. I know that you've cared for so many patients during the height of the COVID pandemic, and you still continue to. And on those front lines, you've come across patients of many, many backgrounds and demographics. So I'd love if you could share maybe a story with us about a patient you've encountered whose health was negatively affected as a result of decisions they made due to exposure to health misinformation.
Oh, no, absolutely. Actually, just this week, one of the rescue workers that was working at the Surfside building collapsed just a few miles from Miami, came in with shortness of breath. He said he was just feeling sick, wasn't sure what was wrong, and he was quickly diagnosed with COVID-19. This is a first responder who is expected to know the evidence and live by the evidence in both his work and in his life, and it was hard for him. He was shocked that he had COVID-19, and he is now one of 35 people in our ICUs, 80% of which were admitted in the last 3 weeks, and 80% of which are working parents in their 30s, 40s, and 50s, all with the same story saying, I didn't think this would affect me. I didn't think I could get it. And they were ultimately, like I said before, more afraid of a vaccine because of these health misinformation campaigns being waged on social media than the virus itself. And it's hard to tell these toddlers and teenagers that are their kids that they might not see their parents again. And sometimes both of their parents are hospitalized. So that is the very real and happening right now situation that is happening not just here though. I think the most heartbreaking thing is that it's not just here in Miami, it's nationwide in every ICU in every city in the country. And even I may have 35 people here, but 3 weeks ago it was only 5. And nationwide, that turns into hundreds, if not thousands of people having the same stories of, I didn't think I could get it. I didn't think I needed the vaccine. And these working parents are now worried about what they're going to do for their kids. And ultimately, we know, regardless of age, 50 to 70% of these people aren't going to make it home, no matter what we do. And that's what's truly heartbreaking. But on a good note, I will say something that positively about health misinformation is that these conversations have been happening, and these families that are being taken care of by us are ultimately helping to change other people's minds. And Katrina, by the way, I've always believed that the world is run out of barbershops, and I've had my barber, who is my neighbor, got COVID-19, and he became an advocate for the vaccine right here in our neighborhood. And whenever I do get my haircut still, we talk about these things because these are real world examples and they're living it. And this reality helps us to have frank, honest conversations with people and help change minds.
That's really phenomenal. And I'm so glad about what you're doing. Can I just ask you, Kevin, on a human note, how do you deal with the immense emotional burden of what you've been through over the last year? I mean, we don't talk, I think, enough as a country about the human cost to our nurses and doctors and respiratory therapists and others who work in the healthcare system and who have been seeing wave after wave after wave and are just exhausted and burned out. So first of all, how are you doing? And how do you cope with the emotional strain of this work?
I mean, it's been hard. I think we talk to each other. There's very little that we can do to talk to our friends that don't work right at the bedside, and especially in ICUs. There's a similar level of PTSD based on some recent data as combat veterans returning from Iraq or Afghanistan as ICU workers have. And I think this is something very real that we have to combat. But ultimately, it's just a personal experience that we have to go through. But we do invest. There is a patient, I guess I'll share her name. Her name is Isabel. She's been our patient since January, and she has had so many troubles trying to recover from COVID-19, but she has, and she's up out of bed, and we've really adopted her as our aunt. And as most public hospitals end up doing, we keep our patients for a long time if they don't have access to care. And it's been wonderful to see her eat her favorite food again. And so I think we invest ourselves in those small victories, knowing that for all the people that we lose, there are some that make it, and those miracles do happen. And it gives us hope, and I think it gives families hope that they'll see their loved ones home again.
Well, thank you again for everything you are doing to care for patients during this pandemic. Dr. Beers, I want to come to you next. As a pediatrician, parents and children confide in you to make important health decisions. And since the advent of the internet, parents have had to navigate this incredibly complicated sort of information environment online and trying to make better informed health decisions. I have a 3-year-old and a 4-year-old at home, and I have spent many an hour, on the internet, sometimes at 2, 3 in the morning, trying to figure out what's going on with my child. This is happening everywhere. And although many parents are simply doing their due diligence, I'm sure that a number of them have inadvertently stumbled on health misinformation. And you've likely heard your fair share of misinformation long before COVID-19 began, just like many of us, who have encountered patients who come to us with questions. I'm curious if you can tell us a little bit about how pediatricians have stepped up as trusted messengers in their communities to address this kind of health misinformation.
Absolutely. I'd be happy to. And I chuckle sometimes. I'm sure you can appreciate this. I mean, there's no class on this in medical school. And many of us, we went to medical school, we didn't even have this. And so we really, we've had to figure this out. And I think, but I guess you so aptly said earlier that the children are depending on the rest of us to figure this out. And our mission as pediatricians and as the American Academy of Pediatrics is to really fight for and ensure the health and well-being of all children. And so we're doing it, and we're stepping up. Individual pediatricians in their offices are, they're talking to patients at the individual level. They're putting, videos on their websites. They are engaging in social media, sharing really good, accurate information to combat the misinformation. And at the American Academy of Pediatrics, we're helping pediatricians do that. We're supporting them with different tools and education. We've also actually reached out to the tech companies and said, there's lots of vaccine misinformation out there. How can we work together to make sure we're getting good information out there to combat the misinformation? And so I think, we're really kind of trying to take a broad approach, because this is just such an important issue, and it impacts the health of children and families so deeply.
I appreciate that. And I got to say, you and I have spoken before, Dr. Beers, but I so appreciate the leadership of the American Academy of Pediatricians in helping to just be such an important force right now in getting accurate information to people. On that point, actually, I would love if you could just say a few words about what AAP is doing and planning to do further to support pediatricians with the increased need to use technology and media platforms to share accurate health information with the public. It's something that some folks are resourced to do and savvy at, others are not, but I'm curious how the Academy is helping support these clinicians.
Yeah, thank you for that. And I'm really actually so excited about this initiative because we're really doubling down on some of the work that we've been doing for a long time. And this is what I think our families need, and it's what pediatricians are asking us for. So one of the first things we're doing actually is working with pediatricians all across the country. And we have chapters in every state. And so we're working with pediatricians all across all of our chapters to train them how to use social media. Some are really savvy at it, some less so, but there's a lot of nuances to it. And so we're working with them to help train them in that and give them, again, some tools and help them, figure out how to do that in their own state so that they can also really address some of the local concerns that are coming up, because it does vary depending on where you live and what your community is. We also are going to be producing, we get questions a lot about the vaccine and how it works and how do we know it's safe and how do we know it's effective and how do we know that it's safe in kids. And so we're producing 2 what we call science explainer videos that are animated and will break down in just really explainable and understandable language what the COVID-19 vaccine is, how it works. I think, we're targeting it, of course, to pediatricians, but I think there's going to be a lot of adults who find it really helpful too. We're also going to record a national public service announcement to really talk about the importance of the COVID-19 vaccine and really all vaccine. And then actually going to be recording about a dozen of our pediatricians who are really, trusted messengers and will be sharing their messages, just across a wide variety of media as well to really increase our reach. So we're really excited about this. We hope it makes a difference. And we're really glad to be able to share it both with our pediatrician members, but also with all of you.
Well, thank you for what you're doing. And I do think it will make a difference. And I'm excited to see the program in action. I want to close this session, this panel, before we go into some audience Q&A by First, just by thanking all of you, not just for taking the time to speak with me today and to share your stories with everyone who has joined, but each of you has stepped up to this challenge and has, of your own volition, decided to address health misinformation head on. That's not easy. It takes time. All of you have busy lives. It takes courage. It takes vulnerability. And I'm curious if, for those out there who are listening, who are inspired by your stories and who are asking themselves, could I do something like this? What role could I play in addressing health misinformation? What advice would you share with them? And we can start, whoever wants to jump in, feel free, or we can start with Professor Caulfield. We can go in the same order.
I think the thing, at least we find with educators, is often educators think, well, I'm not the expert in this thing, right? And so what can I do? And that's true. You're not the expert, but it's much more about helping people to navigate the expertise of others. And that is something that you can become proficient at with just a very little practice in training, right? Mm-hmm. And so I think that, to me, is the thing I find again and again is people want to help, but they stand back and say, I'm not expert enough. Someone else will do this. You don't have to be the expert. You can be the person that helps people to that expertise. And in fact, that's probably the best thing for you to be in the long run.
Yeah, absolutely. Katrina?
I say just be courageous and do it. And just remember, it's just not about you. It's about sharing information with your community and saving lives. So just step up and do it. And like he said, you don't have to be the professional. You just need to share information.
Yeah, those are wise words.
Yes.
Kevin, how about you? What advice do you have?
I would say we learn a lot about the physician-patient relationship, the nurse-patient relationship. Ultimately, I like to say it's about a people. It's about a human relationship with the person you're talking to. Connecting with them, understanding why they feel what they feel is more important than coming with data or with evidence. And I think that finding the time to learn about the people you're talking to is truly the most powerful thing you can do in medicine. And remembering that you are empowering patients with their ability to take care of themselves, not dictate what they must do, but helping them find what they must do. I think approaching from that standpoint is the best way to combat health misinformation and help people truly find it on their own and in a way that's meaningful.
That's so well put. And Dr. Beers, maybe we'll end with you.
Absolutely. Thank you. And I really, in many ways, will echo what others have said, but I think two really key points. First is that, sometimes people think their individual voices don't make a difference, but just to remember that there is real power in your voice. And there's really real power in each and every person's voice, and to remember that and not be afraid to use it. I would say the second thing is to remember your why. Remember why you're doing it. It's to protect the health and well-being of your family, of your friends, of your community, of the children of this nation. And so I think remembering your why can really give you the courage.
Really well put. Well, I want to thank all four of you again for being with us today, for sharing your insights and wisdom, and for inspiring us with what you're doing. And you help prove the point that each of us has the power and also the responsibility to do what we can to help address the spread of misinformation. When we do that, we never know just how far those ripples go, how many people we're helping. But it is very clear from everything we've seen that addressing health misinformation can save lives. With that, I think we may have a few minutes left for some Q&A with the audience. So I'm going to turn it over to Taylor, who I believe has some questions for us, and I'm happy to answer them.
Amazing. Thank you to Dr. Murthy and all the panelists for those insightful and sometimes heartbreaking remarks. My name is Taylor Agajanian. I am a master's student of Library and Information Science at the University of Washington and a research analyst on the Virality Project. I'll be reading some questions to be answered by Dr. Murthy. Our first question comes from an audience member. Can you please address the need for a partnership between public and health experts and educators to advance and promote public health literacy curriculum in schools across the country?
Taylor, that's a really good question from our audience. And you're absolutely right that what's at the heart of this question, I think, is a really important point, which is that digital health literacy is a skill that's extraordinarily important right now. the 21st century is we're inundated with information and we need to decide what's true and what's not. But it's not a skill that we teach people, right? And so we've got to do that more formally, more comprehensively. And this is where I do think partnerships between educators and public health experts can be really useful. In the advisory, we actually call attention to the fact that educators have an incredibly important role to play here. And this advisory is a starting point. It's not an end point. We hope with this advisory, we can help people see the role they can play, but also build partnerships that will help people to execute on the areas where they can make the most difference. Nobody has all of the answers here. Even though public health experts may know the factual information, they may not know how to reach certain people. As some of you have said, on our panel, Katrina and Kevin echoed this for sure. Trust is really essential here. And educators, by virtue of having the trust of students and parents, can do an extraordinary job when it comes to not only equipping people with accurate information, but also helping them build the skills so that they can go forward in their lives and discern what is accurate, what's not, find information that can ultimately help them with their health.
Great, thank you. Our next question actually comes from myself. Do you believe a rapid response initiative like the Virality Project could be implemented at the federal level to combat health misinformation on a national scale from the top down?
Well, that's a really interesting question, Taylor. And I do think that it could be really interesting to look at the idea of having, having a federal organized effort to combat misinformation the way that you're talking about. I think of it almost like a Mythbusters effort to help people bring the sort of direct information to counter things that they may be hearing that are false. And while we each do that, myself and others in federal government and many in state and local government, I think there's absolutely opportunities to coordinate that and focus that more effectively. So yes, I think that that's a really, really interesting idea.
Great, thank you. Our next question is an audience question. How can college students encourage their peers to get the COVID vaccine when they see misinformation on social media?
Well, that's a really good question. Well, first, I'll say that I love the premise of this question, which is it's about peers talking to peers. And that is actually extraordinarily important. I actually began my whole life in public health at the age of 17, building a peer-to-peer education program around HIV, initially in India and then later in the United States. And I've been a longtime believer in the power of peer-to-peer education. So know, first of all, that the trust that you have with your peers is absolutely essential. It's very powerful. Even if you're not an expert, that's okay. The second thing is to share your experiences with people. Let them know how you thought about things like the vaccine and why you made the decision that you did. But remember, all of these conversations first start with listening, right? And so trying to understand where somebody is coming from, why they may be worried. It may not always be what you think. And then if you want to direct them to accurate information, we've put a lot of the scientific evidence together in a simple place, vaccines.gov. That's vaccines.gov. And you can go there and not only find accurate information about vaccines that you can share with your peers, you can also find places to get vaccinated that are really close to you just by putting in your zip code.
That's a really helpful resource. Thanks for sharing that. Our next question is also an audience question. Given that misinformation can spread more quickly than good information, what are the best practices for directly confronting misinformation as it's spreading? And there's also a second portion to this question, which is it always true that the best way to counter bad information is by spreading more good information?
Oh, gosh, that's such a good question. And I think this is one of the challenges we have is that, misinformation does spread more quickly often than accurate information. And it's often being spread by people who have good intent, right? So yes, there are some nefarious actors who are actively and willfully trying to harm others or generate an advantage to themselves politically or financially by spreading misinformation. But much of what we are seeing is people who think they're helping sharing misinformation. And so there are a couple of things I think that are important to do. I think one is if you recognize that, then know that you yourself may be doing that inadvertently. So pausing before you share to check sources, to make sure it's coming from a scientifically credible source is really important. And if you're not sure if the source is scientifically credible, then don't share. Because again, you could inadvertently be causing harm. Secondly, it's important is to if you see misinformation being spread, and if you know where it's coming from, maybe from a friend of yours or a family member, I can tell you in my family that my parents are on these WhatsApp threads, text threads with family members, in India, with friends in the United States. And there's a fair amount of misinformation that gets transacted, on those text threads. And so when my parents show something to me and I realize it's false, then I often will tell them, talk to your friend, not judgmentally, not with blame, but let them know, because they may be unaware, that what they shared actually isn't true. And so doing that with our family and friends, respectfully, kindly, is actually an important step that we can take to also slow the spread of misinformation.
Great, thank you. And I believe this is going to be our final question. What do you hope average Americans take away from this advisory today?
Well, my hope is that people will look at this Surgeon General's advisory and recognize that health misinformation is an urgent threat to our health and well-being, but also that we have a moral and civic responsibility to do our part to address it. And the good news is there are steps all of us can take to address it. As individuals, we can think about what we share and verify sources. Educators and healthcare professionals have a really important role they can play in training people in digital health literacy and also in helping to share accurate information with individuals. We know technology companies have a really important role they must step up and play to slow the spread of misinformation on their sites, whether that's by sharing data with people and researchers about what inventions they're making and the impact that's having, or whether it's by changing their algorithms and making other alterations to their platform to identify misinformation early and slow its spread and avoid sending more misinformation to people who are consuming it. So there are steps all of us can take. But I want people to lastly know that we can address this challenge of misinformation. It will take all of us. It will take a broad, all of society response. But it is something we are capable of doing if we put our mind to it. It won't happen overnight. It will take all of us working closely together. We will make mistakes and we will learn from them. But if we work together, I do believe that we can stem the tide of misinformation and that we can help people get the accurate information they need to make good decisions for their health. That's how we can save lives.
We can strike a balance with amplifying good information, countering bad information, and still protecting freedom of expression. And so I want to thank Dr. Murthy for this advisory and for articulating a whole of society approach that we can all participate in, because as he and our other panelists noted, we have the power. So thank you very much, sir, for joining us today.
Well, thank you, Renee, for those kind words. I do want to say thank you to you personally, because you have been a leader in this effort. Long before many people recognized what was happening with COVID misinformation, you were there looking at the data, looking at the numbers, speaking out, raising the flag, saying there's something here we've got to address and do so urgently. I have personally learned a lot from your work and from our conversations together. And so I just want to say thank you to you for everything you've done, for being such a great partner, for moderating our event today, and just for being a partner in the future, because I know we have lots and lots more that we've got to do together. And lastly, a thank you to everyone who joined us today. I know that this issue of health misinformation is relevant to all of our lives, whether we've been affected by it directly, whether we have family members and friends who've been affected by health misinformation. This has a material impact on our well-being. And it is in all of our interests to do everything we can to understand the scope of this problem, but to take steps in our own life to address it. There are some problems that are so intractable and require such expertise that only a small group of people can address them. Health misinformation is not one of those challenges. There are steps we can take every day in our lives, not just by deciding what we choose to share or not share, but also by speaking up on these issues, by holding to account, whether it's technology companies or other players who may be allowing misinformation to spread, or who in some cases may be willfully spreading misinformation. I'm optimistic that we can make progress in this area. And myself, my team, we're committed to working with you, Renee, with others, who we've been, partnered with over the last many months, and to all those who are joining today, to ensure that we build a healthier information environment in our country that supports the health and well-being of everyone. Thanks so much, everyone, for joining today.